The introduction of the COVID-19 vaccine was met with fear, uncertainty and doubt, many questioning its efficacy. The situation was no different in Garisa County. However, things started to slowly change when one COVID-19 survivor decided to be a voice of change by urging the public to go for the jab. Ruth Munyi was in Garisa County and she now tells us why there was hesitation in the uptake of the vaccine in that part of the country.
It is quiet and serene here, quite a contrast from the surrounding environs. Mzee Hassan Bule strolls on his expansive farm. Here, his fruit farm is flourishing. He stares into the middle distance with satisfaction. He calls this place his paradise. Mzee Bule, a former military officer, considers himself a lucky man. A time like this 2 years ago, he was in a hospital recovering from COVID-19.
Mimi nilikuwa nabatia shamba maji during night time, nikasikia mimi natatemeka, nikasikia ni hali ya kawaida na pneumonia, na huwa kawaida nilikuwa nasikianga kuna corona, lakini mimi nilikuwa ni ignore. Katika hali ile nikaanza kumeza Panadol, nikakaa baada ya 3 days, nikaona hali imenisidia. Nikatorokea banda ya hospitali Garisa, nikamwambia uko na hiyo kitu.
The disease took a toll on his health and he couldn't continue toiling his land. When the COVID-19 vaccines landed in Kenya, Mzee Bule was among the first people in Garissa County to get it. For him, prevention was key. He had already suffered enough.
Baada ya siku 7, mimi naesa ile shindano ilikuwa nakataa, ndio nikaenda kuchukua phase 1. Baada ya 3 months nikachukua phase 2.
The COVID-19 vaccine was met with a lot of resistance. There were lots of misinformation, myths and stereotypes on the vaccine. It was even worse here in Garissa County.
It was actually a difficult thing for us, especially when this misconception came in that people, if they take the vaccine, especially the men, their libido goes down, they become impotent.
The county government of Garissa had a hard time convincing the members of the public to take the vaccine. It is for this reason that they identified a COVID-19 champion who will encourage members to take the shot.
After identifying the community champion, we were able to at least reach to a larger community, a larger group.
The first COVID-19 case was reported on the 18th of May 2020 as per the latest reports from the county government of Garissa. There were a total of 3,000 confirmed cases and the reported deaths 190. The first COVID-19 vaccination was done on the 12th of March 2021. The county government had targeted to vaccinate over 500,000. And out of this number, only 51,092 received the vaccination, with the female population taking the lead with 31,000, while the male 19,000. Through Mzee Bule's mobilization efforts, the uptake of the vaccine went up.
Na nikahamasisha watu, nikachukua mama yangu ambaye iko age of 102, nikaenda karibu watu 18 nibeleka baada ya 1 week.
UNICEF Kenya was very instrumental in sensitizing the public on the importance of the COVID-19 vaccine.
For UNICEF, we supported in mapping out of the key partners who are engaged in vaccination exercise. These are partners from the NGO world, from the ministry, and also relevant community opinion leaders, local administration, and any other person from the community who we feel has an influence in the community. Once we did the mapping of the stakeholders, we were able to call them for meetings and disseminated key information on COVID vaccination.
Religion plays a key role in this area. Hence, there was need to engage religious leaders on the issue.
The COVID-19 was in a high peak. Even we closed our mosques to that extent to be far from gathering.
A majority of residents here in Garissa County were first hesitant to get the COVID-19 vaccine. But once Mzee Bule shared his COVID journey, a majority have been able to accept and go get the COVID-19 vaccine. Ruth Munyi, NTV, Garissa County.